Now, Abort developed deployment of risky vaccines, the caution of a group of highly specialized medical practitioners to government as a push for the withdrawal of attempts to introduce a vaccine mandate in the country. Last week, many public institutions began denying unvaccinated people access to their premises in enforcement of government's no vaccination, no entry policy. But the group concerned Ghanaian doctors, with some of its members drawn from Ghana's COVID-19 case management teams, are opposing the move, citing, among others, the safety and efficacy of the jabs. The group has today presented a 9-page petition to President Akufo-Addo asking him to stop the imposition of the COVID-19 vaccine mandate. Well, a lot of the cases referenced in this petition are outside Ghana and African jurisdiction. What do we know about our Ghanaian situation? Dr. Titus Bayo is General Secretary of the Ghana Medical Association, a member of Ghana's COVID-19 response team. He joins us with more on this. Good evening to you, Dr. Titus Bayo. Now, what does the data say about our infections, their severity, and their relationship with vaccination?
Good evening, and good evening to your viewers. I think the data available from Ghana shows that the vaccines are effective, they are safe. I think the communication has been clear from the beginning that no one says that the vaccines once you take them, you cannot get the infection. You may get the infection, even though it protects you to some extent from getting the infection. But the greatest gain is the fact that it reduces how many people will develop symptomatic disease, how many people will get critically ill and will require ICU admission, as well as the number of people who are likely to die once they are vaccinated. And the data, for instance, from Kolebu last month suggested that in about 6 ICU deaths from COVID, 90% of them were unvaccinated. If you go to the Infectious Disease Center, data there also suggests that even though in outpatient department you might find some vaccinated people getting infected, when it gets to those who develop severe disease and die, over 98% of those who actually die from COVID are unvaccinated, meaning that the vaccine really protects people from death and protects people from being admitted into critical care.
But
so this is the local data that we have.
All right. Dr. Bayo, the statistics, as you've also indicated, points to the fact that there are some people who have been vaccinated who have died from COVID.
Yes. Nobody's disputed that. But in science, we talk about the evidence. The evidence suggests, for instance, and I don't want to put particular individuals because these are people's medical history. We can talk about the statistics. But if you find out the people who have died, majority of them have significant underlying medical conditions.
Right.
As a nation, we can compare our deaths before we introduce vaccination with our deaths after we have introduced vaccination. In our first and second wave and part of the third wave, we have not rolled out vaccination fully yet. In this fourth wave, you saw the total number of daily cases in some months exceeding 1,000, which was perhaps the highest we have ever had in any single day of infection since COVID came into Ghana. Compare the death figures, the mortality figures now, the mortality figures in our earlier waves, and you will notice that even though many people get infected, not many are dying, and this is because of the vaccine.
All right.
If I should provide you with further scientific data, that is not just from Ghana, because some of the data presented by our colleagues is a bit misleading. And I just cite one person. I'm an academic as well. I teach the medical school. I'm a student of epidemiology myself. And look, published data in a recent paper by BMC shows that from 58 studies, global studies that were pulled together, when you have received a full dose of vaccination, the vaccine is effective in preventing you from getting an infection in about 85%. It prevents symptomatic disease in about 97%. And then if you go to hospitalization, ICU, hospitalization 93%, ICU admission is 96% effective against that. And it's effective from death, ranging from 92 to 98%. This is from 58 studies that have been pulled across the country, across the world.
All right.
And this is what the data suggests.
All right. Dr. Bayo, you made reference to the vaccinations and the impact on this fourth wave. But
yes.
The fourth wave has been described, the Omicron variant, which is believed to be the dominant variant, has been described as not as, debilitating as the previous, as the Delta, for instance. So can we attribute all of that to the vaccine, or just a case of Omicron being of less debilitating?
No, there is enough evidence, Israel, as I have just shown you here from this data, and this data was published even before the development of the fourth wave, before the development of the mutation into the Omicron. This work was published in November 2020. At that time, the Omicron had not even become a global disease.
All right.
And this was data. In our own data, like I mentioned, if you look at part of the third wave that we had, when we had vaccinated the at-risk population, majority of those who had this disease never made it to ICU.
All right.
Okay, and the data is there. You can go to the Ghanaian, you can go to Kolebu. I've just quoted the figures from Kolebu for you. The people who have received vaccination, full vaccination, if they get infected, they are not likely. We will never say they can never die, because in medicine we never say never.
Yeah.
People may have other comorbidities that may account for why they will die. But for majority of the people, 98% from the Ghanaian, over 90% from Kolebu, people who are dying have never been vaccinated. So for what reason would somebody want to persuade other people not to take the vaccine?
But the Ghanaian doctors contend that the adverse events resulting from the COVID-19 vaccinations are being largely underreported. What really are you seeing in the world?
What is the data to back that? When we rolled out the vaccination program in Ghana, right from the very beginning, the FDA of Ghana introduced an app for reporting adverse events following vaccination. We have asked any patient who has suffered any form of vaccine-related adverse event to report to the nearest hospital. Doctors have been trained, including they themselves, to report these adverse events. There's a committee, a very robust committee made up of top-notch scientists in this country that meets every 2 weeks to review every single reported case of adverse event, to establish if there is causality, if there's a link between that adverse event reported and the vaccine that the person took. This data is readily available at the FDA. So if we say it's underreported, you need to provide the data. Globally, we are doing a lot of studies. COVID is a new disease. The vaccination itself is relatively new. The scientific world has never hidden information. For instance, when people were having the development of clots associated with AstraZeneca, this was reported.
Yeah.
We didn't report some in Ghana, but it was reported in the international literature. It has been searched recently. A university in Oxford was trying to find out what exactly is leading to that, and thinking that one of the molecules of the vaccine is coupled with may be accounting for that. This tells you the intense research going on to make sure that vaccines are safe.
Now, finally,
we cannot say 100% that all vaccines will never have any problem, but the knowledge we have as of now shows that these vaccines are safe.
Dr. Bayo, finally, what do you think will be the motivation of these doctors to want to come out this way, seeing that they've been involved in this COVID-19 fight?
I thought the motivation is something we need to interrogate. I think their personal beliefs, some of which may be religious. I have heard, from my colleagues, and we are still doing a background check, out of the 10 doctors that signed a petition, their religious affiliation, and think it's something that has been questioned. It is something we are not sure.
All right.
But from the time that it has presented, it does not support the conclusions drawn. And that's why the GMA has come out with that statement that we have issued. The conclusions drawn are flawed. They have data available to them that they are not using. The data I gave you from Kolebu, as you notice from their signatories, some of them work in that unit. And in fact, one of them is responsible for reporting that data. Whilst you will not cite that data that's from your own unit, you took care of this number of patients, and 90% of those who died were unvaccinated. Why will you quote the foreign data to back a claim?
All right.
So the real motive we need to investigate.
All right. Thank you very much, Dr. Bayo. He is with the Ghana Medical Association. Now, the Health Minister, Kwekwagyama Menu, is insisting that government mandatory vaccination policy is non-negotiable. He contends that this is only to protect the country. He spoke on state broadcaster GBC earlier today.
If you come to the Ministry of Health now, we are expecting vaccination card before we allow entry. And we set up a vaccine center right at the door. To set an example, we are testing. If we go to do the executive instrument to introduce these, how will it work for us? So we're looking at challenges that can come with me as a guinea pig in my ministry, and are getting challenges about verifying the codes that we have with which type of device and things like that. So soon things will come. The Ghana Health Service team had actually been to do a strategic meeting, and they've come with proposals that is sitting on my desk. We are discussing, and so we may have to introduce certain protocols that will ensure that people have been pushed a little bit to go to the vaccination. But we also should not be compelled for you to give us your disease.
Do people get a choice to
be vaccinated? We vaccinated elderly people are those we even vaccinate first without testing. And we don't see such adverse effects that lead to deaths and things like that. Every Ghanaian must choose what they want, so I should choose who I move with. So if you are not vaccinated, don't come close to me, period. So if you're going to a public place and you're not vaccinated, both of us there to want protection for ourselves. It's our right. So you don't want to entertain you there. So don't come there until you get vaccinated, or don't come there at all until we finish the battle.